Scotty Appleman from the Appleman Group here with Moses Alvarez. He is the owner of Lycoming Orthopedic Sports Acupuncture right here on Main Street in Muncie. Just sitting down here with him and ask him a couple questions. So Moses, what does your business do?
We provide services including acupuncture, dry needling, electroacupuncture, cupping, soft tissue therapy, and now we've added corrective exercise for populace of the Lycoming County, including areas like Williamsport, Lock Haven, and heading down towards Milton. We get people as far as Dewshore and areas surrounding our immediate within, I'd say, a breadth of about 50 to 60 miles.
Okay.
We also are looking to specialize more in athletics and helping those who are looking to enhance their performance. So between a variety of different physical modalities, we can help people with chronic pain or sudden acute pain related to injury. And so we are collaborators with specialists such as physical therapists, primary care doctors, orthopedic specialists, and those who are dealing with soft tissue injury and rehabilitation.
Okay, awesome. What sort of qualifications do you have to be performing like acupuncture and stuff like that? Like, did you need a lot of like education for it or go to school for it? What sort of education have you gotten for it?
Thank you for asking that. I have a history of related educational certifications. My history, my beginnings include exercise science and sports management. I had my greatest dream was to own my own Gold's or World's Gym. Never got to own my own gym, but I got the opportunity to manage other folks' facilities, and in the interim, becoming a certified personal trainer, helping those who are looking to manage or lose weight, help improve their athletic or daily activities. And in the interim, I then went back to school and obtained a master's degree in acupuncture and Oriental studies in order to further my holistic background. Later on, I decided, I'd like to merge both worlds to be able to provide the whole breadth of the holistic experience. So I went back and became a registered professional nurse. I specialized first in medical surgical and then moved on to total joint replacement to help people rehabilitate after surgery, and then eventually specialized in pain management, delivering epidural steroid injections and nerve blocks. So to answer your question, yes, I had to seek out a variety of different requirements for licensure and as well as certification in order to obtain to do what I do today. I continue to study and specialize in different areas of orthopedics and functional medicine as part of our total package here. So
awesome. That's wonderful. He's qualified. How do you help people? Like what have some of your clients noticed, like when they come in, when they leave, like how does it benefit their life as a whole?
Folks often come to me at the tail end of their experience. Often when people develop pain, chronic pain or acute or sudden injury, they go to their doctor first, and that person is the gateway to allow for a variety of different therapeutic interventions. We start with, say, something simple as medication. We move on to more physical, hands-on interactions like physical therapy. If that doesn't work, we move into something a little more invasive, let's say a local injectable of lidocaine and steroid to help decrease swelling and inflammation and help the person obtain some relief. And if that doesn't work, and we see something on a scan, such as an MRI, a CAT scan, that may be something irregular or an anomaly of some kind that cannot be corrected through outside interventions, then we consider more surgical intervention, correcting a bulging or herniated or torn disc, something that may be compressing a main nerve that's running down one or both legs or affecting someone's ability to sit, stand, use the bathroom, or do their normal daily activity, something that's critical. So it depends on the degree of injury or chronicity, if you will, and I come along that interim, usually at the tail end when folks have tried other interventions with very little or no relief. They come to me and I then offer them a variety of different treatments, usually a lot of soft tissue, a lot of hands-on, and now with our corrective exercise specialist, Caleb Smith, who joined us recently, we are able to do a complete total package. In other words, intervene, assist with acupuncture and the other modalities I just mentioned to you, and in addition, send them home with proper rehabilitative techniques that they can perform at home so they can continue their recovery after their treatments here.
Just gonna hit on acupuncture for a minute. So, what is acupuncture? And because every time I think of acupuncture, I think of just needles all over people's bodies, like in the movies and stuff. But like, what is acupuncture? And yeah, just what is it? What does it do?
Acupuncture is an ancient art and science that has come to fruition or come to life, if you will, about 2,500 years ago. And we, the specialists in acupuncture, have spanned the globe. It could have been anywhere throughout history. We found that the origins go back to 600 BC during the Han, H-A-N dynasty in China. However, there are ancient scripts or scrolls and hieroglyphs that show perhaps acupuncture or some form of it had been discovered in different parts of the world, perhaps India or the Middle East, and then crossed through China at some point, and the Chinese have learned to master it. They've learned to master it for centuries, and they developed numerous styles of acupuncture. It could be needling the hand, just the scalp, the ears only, or perhaps different segments of the body that produce results, if you will. Over these 2,500 years, there have been a lot of discoveries that have led to today's prescriptions or combinations of acupuncture points or areas of high electromagnetic activity that, when combined, produce a result. It could be irritable bowel symptoms clear up. It could be muscular pain that disappears. It could be something as fruitful as someone attempting to conceive and not with no result in a variety of today's Western methods, but they combine the Western methods with acupuncture, and now they are able to conceive and birth a human child. So a lot of discoveries throughout those centuries, and we still continue to apply it. Today, we utilize acupuncture in particular for pain because it modulates brain activity, helping release endorphins, dopamine, and a certain other substances while releasing spasms in tight muscle tissue and allowing someone to fully function or come back to full functionality with less pain and more mobility.
Wow, that's awesome. So does acupuncture hurt?
That's a very good question. That's often a question. First question that comes up is, does it hurt? As we grow up, we tend to be a little stigmatized on the word needle. We tend to experience what we call hypodermic needles. Hypodermic needles are hollow and solid. They deliver a substance into the body, whether it be a vaccine or other form of injectable, and those are very helpful. However, they do cause some tissue disruption, and they tend to cause pain, unfortunately. The beauty of an acupuncture needle is it's a filiform needle, and if you think of either monofilament fishing line or threading line, it's solid. It's even thinner than your own human hair, and it just basically punctures just very lightly and begins to wiggle its way around soft tissue to reach its desired location, creating little to no damage at all, no bleeding. If you just simply take your pincer grip and just twist your skin, that's about the most you feel a sensation during a needle entry. Afterwards, people tend to feel a sense of euphoria, if you will. It's upon the release of endorphins and other substances in your body that your brain responds to the puncture that you often feel the effect that we often read about, that sense of deep relaxation, almost like sleepy but yet alert feeling, and pain disappears by the end of the visit.
So Moses, what kind of clientele do you have here? Do you just help people that have been injured, or do you provide other services for people that maybe just want to better themselves overall?
Yes, we offer, in addition to acupuncture, we offer what we call corrective exercise, and that is a main term that houses or contains a variety of different strength and functional assessments. And in particular, we take a great interest in athletes and those who are very active or maintain active lifestyles. So if you've encountered a situation on the courts or in the field where you've been injured or sidelined and you're looking to rehabilitate or reach maximum potential, give us a call or ask us. I can put those in contact with Caleb Smith, our certified exercise specialist, and we can even bring you in and perhaps perform a basic evaluation to determine lines of function or lines of torsion throughout the body to be able to determine how well your body performs while performing specific exercise protocols or the basic sport activity, whether it's a repetitive motion, like a baseball pitch, or some other high impact activity that may have been hampered by an injury in the past. We can help you evaluate, strengthen, correct, and then reevaluate to determine the best outcome.
Awesome. So do you do anything with like injury prevention and help people build, like, say they have a weak body part or weak, they're tight in certain areas? Like, do you also help that even if they're not injured?
Yes, you actually brought up a good point when you mentioned the word prevention. We believe here that prevention is the key, and so we do provide, should I say, functional evaluations where we determine where you are in terms of your capacity to generate force or muscular strength or output, if you will, through your joints and from your spine. So performing these very specific and scientifically proven strength assessments, we can evaluate areas of weakness and areas of tightness that may be hampering someone's performance, and we can assist in order to prevent injury, whether on the court or in fields as well. So thereby enhancing performance. So not only is it maximizing output, but preventing an injury from occurring in the first place. So we do work with athletes, and if anyone, again, has any questions, we can put you in contact with Caleb Smith, and we can provide even a basic, just a basic discussion or a sit down and being able to evaluate the participant's case and then further intervene, whether it be we do a series, after the strength evaluation is performed, we can then determine the best method of outcome, whether we combine with other modalities or we design a corrective exercise plan for that participant.
Yeah, awesome. So you can just tailor it to what the client needs. It's not, it's not just like a basic thing that you have everybody do. Every single person has their own little like way to improve their athletic performance, and you do it based on their abilities.
Absolutely. We custom tailor a program to the individual based on their scientific assessment, where we take them through a series of movements and we determine whether or not, based on predetermined measurements, how this person performs in that moment. And then we can introduce a corrective system to be able to help them enhance and prevent injury. There are lots of resources out there, and some of it could be confusing, so we can decipher through all that and custom tailor to the participant, him or herself.
Awesome. Awesome. So if you need to better yourself, you have weak body parts, get in touch with Caleb and Moses, and they'll help you build yourself and make yourself a better athlete and a better person overall. Yeah. So you're located right here on Main Street in Muncie. So are you taking on new clients right now? And if somebody wanted to, come and get acupuncture or get some help with their mobility and everything, like how would they get in touch with you?
Yes, they can call. We can reach us at 570-244-4188 and speak with our administrative associate, Christina Marsh. She'll be more than glad to assist you, answer your basic questions, and locate a spot on our calendars to be able to provide you with access. If anybody has any questions and would like to speak to a provider in general, we can reach you again in return and answer your most basic questions. Yes, we are taking new patients either by referral or just simply walk-in. We prefer that people call in advance so we have a slot available for them during the day or in the evenings. We're here Monday, Wednesday, and Friday here at 22 South Main Street in Muncie. There's a second location at 340 Railroad Street in Danville, Pennsylvania as well.
Awesome. Good deal. So what is something that you want people to know about your business? So what is your purpose for having this business?
The two main mottos that I've come across or have created in my practice, my 20 years of practice, is number one is it's your health and it's your choice. We all have a choice in how we manage our health and our ability to function during our lives. And as it states on my website, lycoacu.com, we rebuild your body from the ground up. So we help you rehabilitate from your feet all the way to the top of your head, focusing on the major joints of your body. Once your major joints are in line, your shoulders and your hips, your spine naturally flows and functions and rotates, and your arms and legs move the way they should, hence clearing your symptoms. So your health is your choice, and we help you by rebuilding you from the ground up. It's a wonderful opportunity to serve the residents of Muncie and surrounding locations. I'm very excited to have Christina and Caleb join me as my teammates, and we look forward to bringing the total package and complete rehabilitation in a holistic perspective. From the ancient to the modern, we can help you rehabilitate and seek optimal performance, being the best version of yourself. I believe one of the segments that I have recently decided to take on, in addition to the other modalities I offer, really sets us apart because I have my total trust in Caleb. He is a absolute professional in his field. He actually mirrors what I used to do is exercise science and physiology and kinesiology. So I feel that lends or gives us leverage in providing that total package and being able to help someone rehabilitate completely, not only here in the office setting, but at home as well.
Awesome. Well, Moses, thank you so much for the interview. I really appreciate you sitting down with me and just explaining your business and, providing what you guys do. Really appreciate it.
Thank you. Visit us at lycoacu.com, lyco.com, if you have any questions, or simply do a Google search for acupuncture and Muncie, and you'll be able to see us at the top of the list. We'll be glad to help you in any questions you may have.